Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes in Hell with Decoding. If you're new or you're just coming across my channel for the first time, my name is Ronald and I talk about everything and in between healthcare. So if that's what you're looking for, you're in the right place. And on today's episode, I'll be talking about choosing a specialist path or figuring out what specialization you want to get into as a clinician, right? And now medicine is so wide, it's so diverse. You're looking at cardiology, you're looking at neurology, you're looking at neurosurgery, you're looking at nephrology. The list is endless. Dermatology, rheumatology, the list is absolutely endless. And by the time you're done with med school, you're done with house job, you're done with youth service, then the question starts, what specialty do I get into? And that's where a lot of persons really struggle. I myself struggled, significantly. It's not like I've specialized anyway. I found myself into the health tech part of things, but that's another story for another day. Really, but I had a couple of conversations with myself, colleagues. How do you really figure this out? So I'll just share some tips and guidelines really, and I'll drop a link to a very good guide on choosing clinical specialties so that I can also read and help on your decision part. So as a specialist, right, you get to settle down in one area of medicine. So for example, you're getting into cardiology, so you're going to be doing everything that concerns the hearts, the blood vessels around the heart and all of that for the rest of your life, right? Some people might go as well, specializing in two different areas, but that's a different conversation again for another day. So you pick a specialty and that's what you're potentially going to be doing for the rest of your life, unless you want to do something else along the line. So making a decision on where to specialize is very difficult because that's what you're going to be doing, or it's going to stick with you potentially for the end of your life. If you choose to be a surgeon, you're going to be operating every single day or every other day until you retire. That means you're going to be standing for long hours and potential complications like back pain. Back then I did a lot of orthopedics in medical school. Even post-med school, I assisted in countless orthopedic surgeries up to the point that people thought I was going to specialize in orthopedics. But by the time I started having back pain, low back pain, very bad one, then I knew that surgery was not an option for me. And that's how I abandoned that, right? So in choosing a specialty path now, so there are a couple of questions you want to ask yourself. So I'll just read them out and you just ask yourself those questions, and then it begins to probably start making some, or you start getting some bit of clarity as to how to approach it. So number one, what are your areas of scientific and clinical interest? What organ, system or group diseases do you find exciting? What clinical questions do you find exciting? So some people, once they hear neurology questions, it's like you've touched their button and they start, vibrating, giving you the stuff, the contents, without too much stimulation. So some people it's cardiology, some people is musculoskeletal system or anatomy and all of that. You want to look at what's happening in pharmacology. Are you happy with physiology, anesthesia, radiology? So do you prefer surgery, medical, or a mixed specialty? Do you prefer a specialty that is more procedure oriented, or one that emphasizes patient relationships and clinical reasoning, like internal medicine? So internal medicine, you're not really doing much of procedures. You're just looking like working like a detective, asking the questions, figuring it out, tying everything together, making the diagnosis and giving the appropriate medications. The surgeons, they just get in there, take out diseased organs, or if the orthopedic, they fix the bone. You want to ask yourself that question, right? What kind of activities do you want to engage in? Looking at extracurricular activities. you probably want to look for specialties that allow you that freedom to do those things, like maybe research, teaching, policy work. Your activity options will be determined by your practice setting, where you're working, and the time constraints of your specialties. Now some specialties are very busier than others. Some specialties, they don't take calls. For example, like pathologists, I don't think they take calls really. So typically Monday to Friday, there's really no emergency per se in pathology. So you want to check those things. Then how much patient contact are you looking for? So do you like talking patients? What type of physical interaction do you want with people? So radiology and pathology, for example, really have minimal, in fact pathology has no patient contact really, because you're just dealing with tissues, specimen, and all of that. Then radiology, yes, you have some patient contact, but it's just to take x-rays and or CT scan or MRI or whatever radiological investigation, and that's the end, and you send results back to the requesting clinician, right? Then do you want to go into emergency medicine? Do you love adrenaline? Do you like the mixed encounters you see every day? For example, as an A&E physician, really, you don't know what you expect the next minute, really, so that keeps you on your toes. So if that's what you're looking for, then you might want to look at A&E. Then what of oncology? This again ties back to the kind of relationships you have. So most oncologists typically might be dealing with patients who are end of life, sick, life-threatening illnesses and all of that. I'm not saying people don't recover from cancer, but that's you're consistently breaking bad news to people and all of that. So is that what you want to do? Or you like working with babies, that's pediatrics, you want to check that out. Then you want to ask yourself, how important is work-life balance? In fact, I'm planning a session on work-life balance in medicine. Either it's a myth or a reality, I really don't know. We'll have to answer that question. So how important is work-life balance for you? How many hours do you want to work? Do you want to do shifts or do you want to weekends? How many calls are you willing to take in a month? So if you want to have good control over the number of hours you do every day, then you probably look at specialties like radiology, dermatology, pathology, ophthalmology, sometimes neurology. Then another key part in choosing a specialty is earning potential. Some specialties actually earn higher than others. So are you interested in your earning potential? And you also bear in mind that in some specialties, for you to earn higher, then that requires longer training periods. For example, if you're going to be a neurosurgeon, then you're potentially going to train longer than every other person. So are you willing to put in those hours into training to get into that ceiling of very high earners? So as a general rule, really, most surgical specialties get to be more compensated than the medical specialties, really. So these are some of the questions you want to be asking yourself before you finally decide where you're getting into. So you want to attend interest groups, ask questions, engage in research, talk to your clinicians, your supervisors, the people who lead your team. What are their lives like? Are they enjoying what they do? Is it interesting, or are they bogged down or bored? You want to ask all those questions. Talk to residency program directors. Now, sometimes this is tricky for asking consultants what they think, because what I found out was a lot of persons tend to hype their own specialty. So you find a cardiologist telling, yeah, cardiology is the best, this. If you gotta meet a neurologist, it's gonna tell you the same thing. If you gotta meet a nephrologist or neurosurgeon, everybody tends to hype their own specialty, and that's fine. But I think it's also good for these people to give unbiased information or advice concerning what they do, so that people can make better informed decisions, right? So that means you're asking them the hard questions, forget all of this. Tell me how you feel, what the job looks like, and all of that. Then you want to also look at the specialties, because again, during your rotations, you get to walk around different rotations and you see what the culture looks like. Is this something you want to do for the rest of your life? Right? Again, culture is a big conversation on its own, and even in a hospital, a teaching hospital, you find out that the cultures within departments or units actually differ. So that might not be the best way to check the culture. For example, if you're doing a dermatology rotation in hospital A, that team might be very toxic, and you probably get into another hospital and you meet another dermatology team and the culture there is amazing. So there are chances that first experience you had in hospital A might taint your perception about dermatology in general. So that's why it's really very tricky, right? So, and then while you're rotating, and this is something I did to moving across specialties, I was always taking notes as to what I feel about, some sort of reflection as you're moving across specialties, what you think, and if you're happy with the specialty or not, and I think that sort of really helps in your decision making as to where you want to settle ultimately. So I'll be dropping the link to the ultimate guide to choosing a medical specialty so that you could also, download, read, and have an idea of what it takes, because it's a very important decision. Because again, you also have to, for those who are married, you're looking at your family, you're looking at your kids, you're looking at your wife, all that decision has to tie. For example, if you're going into neurosurgical training, then you know what's going to happen, and considering the whole brain drain and all of those, because training is very intense. There are so many exams to write, there are a lot to do really, so you barely have time for yourself, honestly. So you want to think about all of that in addition to your family, and decide what's best for you. So if you're a specialist who is watching this, how did you decide this was a specialty you're getting into, or this is the best specialty for me? I want to see your comments in the comment section so that other people can be inspired to, and help them make that decision, because it's a hard one. So for me, initially I thought I was going to do orthopedics, then the back pain came up, so I knew surgery was off the list. Then what happened next? So I started looking for other specialties I could get into, but nothing really appealed to me per se, because right from day one I loved the thrill of surgery. Then I considered O&G for a moment, but I think the whole being on call, emergencies, for example, a woman could have fetal distress, for example, right? You have to get to the hospital. If you're the specialist on call, you have to be on call, So all of those things are like, no. I really want to sleep in my house and rest, right? So O&G off the list. And I kept on checking, and I came across pathology. I started looking across who were the eminent pathologists, what they were doing, what their life looked like, and it looked like what I was interested in. But Nigeria happened to me, because looking for residency in Nigeria is another kettle of fish. I think it's the same problem globally, right? But I traveled around this country looking for residency, but it wasn't forthcoming. Even despite having primaries, you've passed your primaries either of the national or West Africa or both colleges, and it's still difficult to get into a training program. Sometimes people are asking you for bribes to get into programs like that, and what happens if you don't have 700k, 1 million as at that time to pay for a spot in residency? Then it becomes an issue, really. So that was what happened, and I dropped pathology, and for some reason I stumbled into health tech, and here I am, doing health informatics related stuff and all of that. So that's just a little snippet about my story. So yeah, I've not specialized, so I'm in a different part of healthcare at the moment. So I'm looking forward to getting your comments and your stories in the comment section. And thank you guys for watching this episode. I'll see you in the next one. Bye for now.